Welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today are Terri Neiderhammer and Debra Philyaw from Helping Hands Clinic. Welcome, ladies.
Thank you.
Thank you.
Thank you for having us.
It's a pleasure.
We have something important to talk about today. A big celebration, 25 years of Helping Hands.
Woohoo! Absolutely.
It's crazy to think it's been 25 years.
And Debra, both of you have been with Helping Hands most of that time, so you're great people to talk about the history and tell us a little bit about, let's start with, what is Helping Hands? Who do you serve? What are your services?
Sure. So Helping Hands, of course, yes, we've been here going on 25 years this month, actually. And we are a medical home, really a medical home for people who are uninsured in Caldwell County. We serve only adults between the age of 18 and 64 and provide them with chronic disease management, urgent care services, dental with a partnership with the health department. We've got a service where we can do free eyeglasses, and that could be for anybody in the community, so we really want to promote that. If you are uninsured and low income and don't have access to getting your free prescription eyeglasses, we can probably help you with that. We have a pharmacy, which is kind of our big baby. We love our pharmacy, and we help we do 15,000 prescriptions a year out of the pharmacy. So it's really just an amazing journey that we've been on. When Terri starts to talk to you in a minute about how we started, it's like, just invite everybody to come to our open house on the September 14th? Yeah, 14th, from 4 to 6, because to see the clinic now as opposed to what it was in a little tiny building across the street from the hospital years ago, it's pretty amazing. But we have an amazing staff who, of about 8 people full-time, another, I think, 8 or 9 probably contract folks, and a couple people who are just part-time. And they provide just so much care and love to these patients that most of the patients simply cry when they have to leave us. I mean, when they get Medicare and Medicaid, they do not want to leave Helping Hands, because we are able to build such a great relationship with these patients, and they trust us. And that's, I think, the biggest thing is we want patients to feel like they can come and that we are trusted and that we are, give them the best care that we possibly can.
In a loving environment and not judgmental.
And a respectful environment and
provide dignity.
And encouraging. I think that's the thing that we do best at Helping Hands, and why you don't really see that a lot of times with your doctor, because they're so busy. They're having to see so many patients, and we are able to spend a little bit of extra time with them, and they feel that. They feel that personal touch, I think.
And then once they graduate and get their insurance or their Medicare or Medicaid, they volunteer with us. They come back as volunteers. So they can show love from that side of the table, which is fabulous.
So how did the organization start?
Well, back years ago, 25 years ago, well actually 27 years ago, a group called Healthy Caldwellians, it was based out of the Public Health Department, teamed up with some of the social workers from the hospital. And years ago, we had recognized the need for assistance with medications. We realized that a lot of people frequented the emergency room because they didn't have a physician. So grants were written, Healthy Caldwellians did that, and lots of money came in from Duke Endowment and some of the larger foundations. And we got Dr. Snow's office, which is down behind Medical Village Pharmacy or Medical Arts, and it was maybe 800 square feet. We had one full-time employee, the executive director, and a part-time, the administrative assistant, and everybody, the physicians, the pharmacists, the pharmacy assistants, the x-ray people, the lab people, everybody was a volunteer. And we were open only 2 nights a week. And local organizations, civic organizations, churches, Mom's Kitchen brought our supper every night. We had pizza, we had casseroles, we had anything you could think of. They would feed us because we opened at 5:30. Nobody had time to go home and fix supper or anything before they left work or after they left work. So, and we had 2 tiny little exam rooms. Our lab was literally in a closet with the big old iron pipes. I mean, it was scary. It was dark. It was scary. The break room where we had our pizza and our casseroles was the boiler room that made all kinds of background noise. Barbara Wallace, Dr. Wallace's wife, donated lots of equipment, the exam tables and the fireproof doors and some of the other, the medical equipment, the exam equipment. And we had a wonderful time because it was just fun being there. Originally, we helped and underinsured folks with the medical aspect, but back then, the part of Medicare that pays for prescriptions didn't exist. So our pharmacy was for our patients as well as senior citizens who couldn't get their medication. These were literally the people who were choosing between their food and their medicine. And we truly saw people who were eating dog food instead of Kraft macaroni and cheese because it lasted longer. We provided a lot of insulin. We helped a lot of diabetics, hypertensives, hyperlipidemias, obese,
COPD.
congestive heart failure. Yeah, a lot of the acute and chronic diseases that people in our county deal with every day, and there's a lot of that. We're one of the higher rates in the state for those comorbidities, so we help with their medication. So we had lots of seniors coming in and going to the pharmacy. Then once Medicare began covering prescriptions, that decreased dramatically. And that's pretty much just our regular patients now. But we have a few who, once they go in the donut hole or can't get their medications. But it was just a wonderful place to be. You looked forward to volunteering. The doctors volunteered. It was great. And it still is.
Yeah.
But when you're starting out, you think, are we going to be able to sustain this? Are we going to be able to keep the money coming in? Are we going to keep the volunteers? And now we have regular hours, just like a physician's office. So so we don't have to do the nighttime thing.
And I think like Terry talked about with the chronic disease patients, I think what we were seeing at that time, because I was actually working at the hospital at Caldwell, and we were seeing a lot of these folks with diabetes and high blood pressure and chronic breathing ailments come into the ER. And they were going to the ER, and then they were coming back. They would be treated and maybe give a little bit of insulin, and they were coming back, in another month or two and seeing a different provider. And it just was not an appropriate setting for a chronic disease. They needed to be in primary care, but without insurance back then, there was not really any place for them. There's so much more now that we found to help the uninsured. But then, like Terry said in that day, it was very slim. So I think that was one of the reasons why we saw such a need for a free clinic. Burke County had just opened theirs like a year before, and really to help those folks stay out of the ER, number one, the cost savings to the entire county and to the hospital, but number two, so that they had some regular treatment and they could keep their diabetes under control. And have the same doctor seeing them, and that consistency and that continuity of care. So when they were coming to the clinic, maybe they did see a different doctor, but it was one of maybe 5 or 6, and but they were coming regularly, and it was free, so they could afford to come and see. And then we started getting their medicines for free, and the insulin. You're talking thousands of dollars. So that was huge.
And to create a permanent medical home for folks so that they can monitor and manage their chronic illness on a regular basis keeps them out of the emergency room. And in the long run, it affects the whole community because you're not seeing, when you have someone who isn't insured and you go in with your Blue Cross Blue Shield, then it runs up your rates. So by serving folks at the clinic and eliminating those necessary but in a way unnecessary visits to the ER, it impacts the entire community. It impacts their work environment, your ability to go to work. If you can't manage your diabetes, then you can't go to work. You can't support your family. It's a circle.
Yeah, and breaking that cycle was important too. I think that was an important mission of the clinic, and our mission today is to improve a patient's health with their engagement. So to give them the tools, we can give them the tools, but we need them to partner with us and engage with us so that we can bring their hemoglobin A1C, which is their measure of diabetes, and bring that down, get their blood pressure under control, help them be able to breathe better with medication, or to educate them on the negative effects effects of smoking or tobacco use. So all of that we do, and we really concentrate on education to really help those patients and encourage them. Like I said, we can give them the tool and give them the office, and we're there, and to be able to teach them. I mean, some folks have just never had any education with their diabetes. I mean, we get patients who come all the time whose diabetes is off the charts, and they just said, we've never had any formal education.
And it's generational.
Yeah.
If your mama didn't know how to manage her diabetes, you of course are going to be diabetic as well, and you're not going to know how to manage yours.
So it's not all about just giving them medication and care, but it's about, like I said, building that relationship with them so they'll trust us enough to to want to do better. And I think a lot of times they see that. They see how much we care. So it's like your child. They want to please you. So, if we build that relationship with them, they're like, well, they're doing all this stuff for me, so I want to try to get better. So we've seen some of that too, which is really exciting to see how much they love coming to the clinic. And it's like, they're doing well. We've seen, had lots and lots of success stories over the years. But so that's
So we
exciting.
eventually outgrew Dr. Snow's office, and we wrote some grants, and we purchased the old Pilkington building. We remodeled that and created a much better space. We didn't have to be in the boiler room. We actually had a table in a little room where we could eat our pizza. The pharmacy grew. All of our services expanded, and then eventually the other side. What was in that building before?
That was a probation office.
Right.
Was
Okay.
Lily Bunch was our executive director at that time, and we knew we were outgrowing the space. When we moved to that space was the first time we hired a physician, because we were day hours. And we still had some evening hours, but it was getting harder to find enough doctors who weren't working who could come and volunteer in the evenings. So we moved to day hours. We partnered with the hospital to have a program called the Caldwell Health Access Program, which allowed us to pair patients with doctors outside in their practices, which was a great program. And so we had one part-time physician in the building at Helping Hands. So we realized the need was just growing. And then, of course, when all the furniture left Lenore, that created a big influx of patients needing help because they lost their insurance. So that was probably when we realized, okay, we're going to have to expand. We're going to need some more provider staff, medical staff. And so the building, there was no way we could hire staff, but we had where to put the patients. We had 2 little exam rooms and, just tiny. So the probation office was moving out. We went to the Pilkingtons, who owned the building, and they leased that part to us at probably another, 1,300, 1,400 square feet. And we've been there ever since. And we had to knock out the wall and, actually through 6 inches of concrete and brick, but it's been great. And now it's just, that's what we know when we think about having that little space. Now we look back and go, I can't believe we worked out that space.
But we did. We did, and now we have a real lab. And
yeah, we do on-site labs 2 mornings a week, so they can come and get their labs through a donation with LabCorp. So just the community partnerships that we've built over the last 25 years, we're so grateful for. We partner with most of the healthcare agencies, health department, West Life Health, which is Happy Valley Collinsville Clinics. The hospital is a huge partner with us. And when I say partner, it's that, we all are doing something different, and we all know what we can do. And so if I can't do something at Helping Hands for a patient, they might have a resource to do that. So that really is the magic to it, of collaboration. And the collaboration here in Caldwell County that I see with healthcare is better than I've seen in a lot of other, or heard from other people at other free clinics. So we're really blessed to have the health department and Westlife and the hospital and everybody kind of working together, and mental health, of course, too.
And you mentioned your key players. Who have been some of your key supporters over the years, as you think about that?
Oh, wow, we have several.
Gosh.
Starting out, I'll let you start out and then I'll kind of jump in.
Well, we started out with the Duke Foundation and Broyhill Foundation, and Healthy Caldwellians put in some money. It was state money. That doesn't exist anymore, but Debbie Nelson and Jan Pritchard were key to authoring those grants and brought in the foundational money. But we had churches that began including the clinic in their annual budgets. Civic organizations were doing that, individuals, and then we developed Pot of Gold, so that's a huge fundraising. That's our signature fundraiser, and it supports us very well.
It's a little less than 10% of our annual operating budget comes from Pot of Gold. And currently, some of those partners, the Broyhill Family Foundation is still a wonderful partner. Bernhardt, McCrary, Modern support Pot of Gold. We have lots of wonderful sponsors for Pot of Gold. Too many, and I don't have notes to mention all the people that support us. But churches, probably about 20% of churches are in our budget that give to us on an annual basis. Like Terry said, they're super supportive. And if they're not bringing money, they're bringing paper towels and toilet tissue and clinic supplies and over-the-counter meds that we can give to our patients. But yeah, there's just so many folks. Coffee Foundation, Hogan Foundation, lots of foundations here locally that we've had just built a relationship with who, they come and see the clinic and they see the work we do and they appreciate that we're good stewards of that funding. And I think we really have been. If you come to the clinic, it's not going to look like maybe a fancy private funded clinic. I mean, we have, we've got some structural issues that we're working on where we don't have fancy artwork, but we've got all the necessities that we need. And
we have artwork that's been donated by some of our patients who paint or who draw.
Yes.
We have some of Dr. Jane Carswell Roberts' art. And lots of candids around of our family staff and our patients. But you come into the clinic and the smell of alcohol doesn't knock you down. It doesn't smell clinical. It's comfortable.
Yeah.
And I'm going to share the Christmas story.
Okay.
So the first year that we were open, of course, we opened in August, and Robert Huffman was the social worker at the hospital then. And that particular night, that afternoon, Robert called me. I was a social worker in Hickory at the time, and he said, let's put up a Christmas tree. I said, okay, let's do. So he brings in an artificial tree just before we opened, and he went on and put it together. Do you remember boom boxes? He had a boom box with a tape in it with Christmas music, and he had gotten all of these ornaments and stuff. He and our patients played Christmas music and put up the Christmas tree and drank Coca-Cola and Diet Coke because we had some stuff donated and put up the Christmas tree. It was just like a family enjoying their time together, putting up that Christmas tree. And that's one of my favorite memories of the clinic that demonstrates the closeness of the staff, even though it was just 1.5, with the volunteers and our patients.
And I think, although you've grown, you have maintained that closeness with your patients.
I feel like we have.
Oh, yeah.
Yeah, I do. I feel like I said, very rarely do we not hear, oh my gosh, I don't want to leave. I got my Medicaid, but can't I stay here? And that's hard because you do build such a relationship with these folks, and you're going to be sending them out into the unknown because a lot of these folks have, some of them have very limited education, some of them don't read or write.
They have poor social support.
Yeah, they don't have
social
good,
system.
Yeah, family support system. So we are, a lot of times, you can walk in any day and a patient may be talking to April at the front desk for 10 minutes telling them about what happened over the weekend, that their mom passed away or their son got in trouble, or, so it's very important to them, and it's very important that we transition them, and we do that. We try to work with them to make sure that they are transitioned to a new provider and they have their medicines they need during that transition period. And we're going to be doing probably quite a bit of that over the next few months with the Medicaid expansion. So we're already anticipating how we can help folks figure that out, because the uninsured world is very, very scary. And a lot of us have never really been in that world. And if you never have, you don't really understand. And it's not something that you maybe want to support because you just don't understand it. But I've seen it for a long time. I've been here a long time at the clinic, and I've worked at the hospital working with uninsured. And just the anxiety of thinking, I might have a $100,000 hospital bill, and I have no way, how am I going to pay that? So that's another thing I want to talk about, is we really try to help anybody who's uninsured or underinsured or just simply don't know how to navigate the healthcare system. I spend, I'm going to say, at least 50% of my day doing that by phone or in person and just trying to make sure they understand what resources are there. Even if we can't provide them. So, and Terri does some social work at the clinic with folks who are trying to get disability or who think they might be eligible, and she and I both can evaluate them and say, yeah, I think you probably should go ahead and start that process, or maybe let's wait and see how you're doing, or just trying to help them figure it out, because it's a very difficult process. It's very confusing, and it's overwhelming, especially if you don't have a high school education and maybe don't comprehend well.
Well, I'm going to say, even if you do have a high school education and sometimes even a college education, disability is quite complex.
Yeah.
And to have someone who knows, who can give you that, yes, go ahead, I think that's a huge benefit for folks.
Yeah.
I think it's needed more and more, and we see it more and more. We even see it especially with our elderly folks who already have Medicare. I always say they give the most complicated insurance to the folks who understand it, could possibly understand it the least. I mean, I know even with my parents, and they're fairly educated. I mean, my mom's always like asking me questions about, well, should I take this policy or that policy, or what does this mean, or what, it's very, very complicated. So we're here, just if people have general questions about, they want, is something available in our community. There's also, just with that said, there's a good United Way resource called 211. It's very underutilized. So if you have any questions, it's for anybody. You just pick up and call 211. They'll say, what county do you live in? And then if somebody comes on and says, this is what I'm looking for, and they can let us know if we've got anything in that county. So, and Helping Hands is on there. So if people called and said, I need an uninsured clinic, they would refer them to us. So that's a good resource.
We hear a lot from people in the community who are not knowledgeable about what we do and the people we serve, who jump to the conclusion that these are people who are just laying around, they're just taking advantage of the system, they're just exploiting the clinic. But we're not enablers. We empower our people, like Debra said, to take charge of your health, be a participant in managing your acute and chronic illness. A lot of our folks are working and they just can't afford insurance, or their employer doesn't offer it. So we help those folks, and Debra has been key. I'm just so proud that we do this. When we first opened the clinic 25 years ago, I can honestly say we had no Latin patients. None. No. None at all. Now it's 38%.
We're probably 35 to 38% Hispanic patients, and I would say 90% of those speak no English or very, very minimal English. So we've had to hire interpreters, which has been a big change. And but they are the most gracious patients. I mean, they are just so, it's difficult because you have a language barrier, and you've got sometimes complicated medical issues, and you've got a cultural thing that's we're all learning at the clinic how to take care of folks from a different culture. So that's been a challenge, but we're so happy that they feel comfortable coming and that they feel safe and cared for. But yeah, I mean, we're just, we want to treat anybody and everybody regardless of, we are not a faith-based agency, and either here nor there. It's just a lot of people think, that we're funded through churches. We do get some church funding, absolutely.
Yes, but we will accept a check from a religious organization.
But we just want everybody to feel welcome, regardless of creed, faith, color, whatever, race. We just want everybody to know, because if we're taking care of you, you're not going to hopefully be in the ER. And again, like Terri said before, our goal is to try to keep the cost down for the whole community, for all of us. And this is how we can do it much cheaper than they can at the hospital, because they're paying lots more staff and lots more expensive equipment they have to pay for, and so we can do the basics, primary care, better. And
really, a lot of who you see, and you've mentioned this, are those chronic disease patients. diabetes,
Yes.
COPD, high blood pressure, things like that people have to take that monthly medicine for. And that's what your pharmacy is filled with,
Yes.
are those
Yes.
medicines.
Yes, and we keep a decent stock of antibiotics for patients who just need to come in for an ear infection or a urinary tract infection, or they come from the ER and need an antibiotic. We can maybe fill that for them. So, but primarily, yes. And it didn't really, it did start out that way, but it has even grown even more. There is, and that's the thing we, all have to do is just learn to educate people, because I think in our county we see, a lot of folks who are overweight and just don't understand diet, exercise, all of us. We all battle, as women in general, we battle our weight, but just, and then there's also that mental health component that goes along with it. If they're feeling bad physically, they're feeling bad mentally, or vice versa. So we are also addressing that mental health need with we have a counselor 1 day a week, and that's been a great partnership with Breeze Wellness out of Granite Falls. And then of course we do refer to RHA or to Jonas Hill through Caldwell if they need more significant care.
We have educational opportunities, smoking cessation, diabetes education,
We can get folks
obesity management. Yeah,
pretty much what they need. It's, there's going to be times when there's specialty care that they may have to travel to Chapel Hill for through the UNC, but we help those folks get charity care so that they can go to Chapel if they need to. They can go to a specialist and they can get that for much reduced cost than they would have to pay if they were just self-pay. So they're very appreciative of that too.
and part of the ownership that our patients take is they do donate to us. They pay a nominal amount, for their prescriptions, and if they don't have it, then it's okay. We're still going to give you your inhaler.
It's a donation. We dare,
It is.
I tell patients all the time,
Don't sweat it.
Don't
It's
sweat
okay.
it. Come get your medicine. If you don't have $5, don't worry about it. It's no big deal. We don't want them to ever not come and get their care. But we do say, those donations are important. They help keep our clinic funded as well as, they go in that pot of money with all the grants and the pot of gold and everything else. And most of them are just super grateful. So they're happy to give us a small donation.
Okay, with all of this going on, you're also going to celebrate, right?
Yes, we are.
Yes, we are.
We've been celebrating a little bit all year and talking about it and putting a few things on Facebook. But
we celebrate every day that we have this opportunity to meet this need, because one of the things that our team does, the board of directors does, and along with the team, is recognizes there's a new need and we need to address that. So that's why we have our translators now and some of the expanded programs, and our board of directors is very supportive. So they're going to help us with this celebration.
Well, tell me what's coming up.
Okay, so September the 14th, 4 to 6 p.m. at the clinic, 810 Harper Avenue. Just come by. It's open to the public. Come by, see us. Come see the clinic if you've never been. We'll be there to answer questions. We'll be there to share memories, share history of the clinic, give more details than what we give today, some more anecdotes. And, I didn't remember that I was the first volunteer that signed up till Terri reminded me. That was how many, 25 years ago. So I'm like, I can't hardly remember what I had for supper last night. So just come by and see us. We're going to have some refreshments, and the staff will be there so everybody can meet everybody. We will have some cool little door prizes, just some little freebie gifts to pick up and enjoy, and little takeaways. But mostly just, we just want people to come and see the work we do and see where the magic happens, because I really do feel like it's magic sometimes, that we're, and we have the ability to do things sometimes, like get a prescription filled for somebody who's maybe they're kind of outside of the guidelines for other programs, but because we're a private agency and we're completely funded through donations and not any government funding, then we can, if they're $1 over income, I can help them.
We can make exceptions.
We can make it.
It's up to us to make that decision.
And I think that's why I tell people all the time, is why this has been one of the most rewarding jobs, I think, that I've had, because you have the ability to really help people and that's what I want, and that's all I've ever wanted to do is just try to help somebody have a better quality of life.
And I love that because there are people that it's $1, it's $2
Right.
over whatever that government limit is.
Yeah.
And the answer is no, but that
Yeah.
$1 or $2 is not going to buy your medicine.
No.
It's not going to buy your groceries. They still need help.
Yeah,
Right.
And that's the thing about state funding is like they have those guidelines and those poor and it's I feel sorry for the workers having to process applications when it is state funding because I'm sure they're like I don't want to have to turn you away.
Right.
So that's why we love it. So we don't have to turn them away. We can
And by
try to help.
providing the medical care, and they don't have to pay out of pocket, and the pharmaceuticals, then that allows them, say you work at Bernhardt, that allows you to redirect your budget towards meeting your rent, buying your children's notebooks for school and their clothes. So it helps support their budgets. Yeah.
Yeah.
It like frees up that money so
Right.
that you can put
Our
your
patients have we all have complicated home lives and social issues we're dealing with, but when you are poor, it's even more so because, at least if you've got money coming in and you can pay your bills, you can kind of deal with some of the hard stuff that comes along. But when you're just struggling to pay your bills or put food on your table or pay your kids' daycare or whatever it is, then that just creates more stress and you're trying to work and you can't ever feel like you get caught up. So any little thing we can do, we're just one piece. We're just healthcare. There's so many other pieces to that, but we try to make sure they know where to go access that other stuff too. So we're not just saying, oh, okay, now you're enrolled today and we're going to do this, but we're also in our interview process to enroll a patient, we're saying, are you okay? You have any anxiety, depression? Do we need to look at any of that?
We screen for food insecurity.
yeah.
Here's a list of local food pantries.
Here's a list of the local food pantries. Mental health services. If it's or if you're not enrolled, here they are. Substance abuse. If they've got a friend or a family, or if they've had prior, or they feel like they may be struggling, here's the resources that are available. So we keep an internal resource list too, and all of our staff is well aware of, if they're not going to be super familiar with every resource, but at least it's broken down, and if that patient has a question, we can help them figure out how to get there. Or get
And
in
I
touch with
imagine you have
somebody.
patients who, they may not mention it in the interview process, but when the nurse comes in, they may
Right.
feel more comfortable talking to him or her. So,
Or the doctor,
Or
or
the
when they get to
doctor.
the doctor, or the PA, or the FMP, we're like, well, they didn't mention that when they came in, but
Or even when they come to me to talk about disability and I'm screening them to see if they're appropriate for referral, I ask them, do you have enough to eat? And it's amazing, of my 10 or 12 in my caseload, they don't. So I refer them. They don't even know that they're eligible for food stamps because this may be a new situation for them. They've just lost their job or the plant's closed, and they are embarrassed to go and apply. And that's when you remind folks, you have paid into the system. It's okay to go apply for food stamps. You need to feed your family and yourself. And that supports your overall medical health. So
yeah, I think barriers are pride is one barrier, I think, and then just not knowing. I mean, I get calls every day from people say, I didn't even know Helping Hands existed. And for us, that seems crazy because we've been doing this for so long. But like I said, if somebody's had insurance their whole life and suddenly they lose their job, or they're separated and the spouse is carrying them and the spouse stops carrying them on their insurance. I mean, it could be a number of reasons, but they're like, I've never been in this situation. I've never needed to know about you guys or anything. So those are some of the heartbreaking ones because they're especially if they're getting up there close to retirement age and all of a sudden they've had all this their entire life, but they're so grateful, that somebody's just taken the time to tell them, okay, there's hope,
and we're here.
Yeah,
and we
here,
love you, and we don't judge you.
And here's some resources and some things you can check on.
so if someone needs Helping Hands, or if they're generous and they want to make a donation, or if they're generous with their time and they want to volunteer, how can they get in touch with you?
So if you want to basically, if you want to get in touch with me, if you want to see if you qualify for Helping Hands Clinic, just call me. The number is 754-8565. I'm extension 313. And if I can't answer your question, I will figure it out. To make a donation, you can mail us a check at 810 Harbor Avenue, Lenoir. If you would like more information about the clinic, to know more about what we do before making that donation, Brittany Bond is our executive director. She's extension 308, and she'll be happy to come out. She'll do a presentation for your church or civic group, or we do that quite a bit to explain our services. But she can answer any questions. It is all tax deductible. We are a nonprofit 501c3. It's licensed by the state, so it's all taxable donations. And what was the third thing you asked me about?
Volunteers.
Volunteers, yay.
Come on.
I know. So also for me, call me, extension 313, again, 754-8565. But just give me a call, because I'll be honest, we don't have as many opportunities for volunteering as we did, but we still use about 15 to 20 volunteers per week. It's primarily in the pharmacy. We have volunteers a lot in our pharmacy. It is most of our volunteer positions. There is some training, so I get a lot of folks call me like from high school students. I don't really have anything for high school students to do, because most of our stuff is very confidential, and it's training. So we need to spend about a week or so training you, or a few days, and then so we want people to be with us kind of long term. So we do have a lot of wonderful retired school teachers and professionals who are retired, who come in and commit 1 to 2 days a week.
3 requirements to be a volunteer.
Board members.
You have to have a blood pressure, and a pulse, and an open heart.
Yeah.
Blood pressure, pulse, open heart. I think,
And breathing, so 4.
I feel like most of our viewers probably meet those requirements.
And I say, if we don't have anything for you to do right now, it could be something later, or, again, if you just want to help us purchase something on our wish list, we have tons of things we use that have to come out of our general operating budget. So we have lots of stuff, and then we'll get a church group or somebody to bring in
we always need toilet paper and paper towels.
Yeah, I mean, or black ink pens, or
a lot of hand washing goes on there.
Yeah, a lot of hand washing. So, but yes, they can call me, and
you also have a website, and we'll put that up.
Yes, put the website
so
up
folks
there.
can see it, and that's probably where your wish list is located.
It is.
If I'm a guessing person.
Yeah, and I don't think there's anything on there about our anniversary per se, but yeah, September 14th, 4 to 6 at the clinic. That's a Thursday afternoon, and just to drop by. So just drop by. It's nothing, no formal presentation. We just want people to come by, and we'll share some stories. We've got some scrapbooks, some pictures, old pictures to look at.
Pictures of me with brown hair.
Yeah, pictures of you with brown hair. Pictures of us very much younger.
Yeah.
So it should be really fun, and just to share and to see the clinic. I feel like when people come to the clinic and actually see what we do and hear what all happens in the clinic, that's when they get on board. They're like, wow, we didn't really realize we didn't understand. We didn't know what you did here. So.
And I will say, as someone who visited the clinic, I think we did a tour a few months ago. It's amazing what goes on there. And I walked into the pharmacy, and I'm like, wow, it's
a real pharmacy.
It's a real pharmacy, and there's a volunteer in there, and I'm like, I don't think I could volunteer here. And the volunteer working there was like, oh yes, you can. And she went through her routine, and I'm like, I can count.
Yes.
Right.
Yep.
And we're a pharmacy just like Walgreens or Walmart. I mean, it's a registered, licensed pharmacy.
And it's automated. I mean, they call their medications in on the phone just like you would if you were out. I mean, it's really amazing compared to what, like Terri and I said when we started out, when they bring their bottle back and say, do you have any more of these pink pills? So, but yeah, it's a lovely place for uninsured folks to get their health care, and we're thrilled that we've been able to sustain and be there for 25 years. It's really, I've been there 18, and I can't even believe I've been there 18. It's flown by, and 25 years has flown by.
And we're looking forward to 25 more.
Yeah. And
we will be here.
And if anybody knows anyone who was associated with Helping Hands, either in a volunteer or employed there or any way, shape, or form, please send word out. Call them and tell them to come to our open house. We'd love to see them. Terry's invited some former people that were, that we could remember. We've lost some folks along the way, of course.
Sure.
In 25 years you would, but there's people moved away and stuff. But if word gets out, we just want the word to get out and just come by and say hello.
All right. Well, looking forward to it.
Thank you.
Thank you both for being here.
Thank you for
Absolutely,
having
thank
us,
you.
and
Thank
thank
you
you,
for having
Caldwell
us.
County, for supporting us.
Yes, such great support from this county.
And thank you for watching Caldwell County Today.